Here is the detailed and expanded explanation of the lipoprotein electrophoresis test. How 1. Introduction. Lipoproteins are particles composed of lipids and proteins, apolipoproteins, that transport fats through the bloodstream. Abnormalities in lipoprotein levels or composition can lead to cardiovascular disease, pancreatitis, and other metabolic disorders. The lipoprotein electrophoresis test is a specialized diagnostic method that separates and identifies various classes of lipoproteins, enabling a visual and semi-quantitative analysis. Though newer methods like lipoprotein subfraction analysis, NMR, exist, lipoprotein electrophoresis is still useful in diagnosing rare or inherited lipid disorders. Definition: lipoprotein electrophoresis is a laboratory procedure that separates the different classes of lipoproteins, chylomicrons, VLDL, LDL, HDL, in a blood sample using an electric field applied to a gel medium based on their size, charge, and density. The resulting bands are stained and interpreted visually or with densitometry. 3 indications. Lipoprotein electrophoresis is ordered when a more detailed lipoprotein analysis is needed, particularly in cases such as suspected familial hyperlipidemia, unexplained elevated cholesterol or triglycerides, young patients 40 years with premature coronary artery disease, individuals with xanthomas, lipid deposits on skin, tendons, recurrent pancreatitis with hypertriglyceridemia, evaluation of abnormal lipid panel with normal or borderline LDL, HDL levels, investigating rare lipid disorders, e.g., Tangier disease, beta-lipoproteinemia. Out of 4, used for differentiating types of hyperlipoproteinemia using the Fredrickson classification, assessing qualitative abnormalities in lipoprotein distribution, evaluating response to lipid-lowering therapy, helping identify secondary causes of dyslipidemia, e.g., liver disease, hypothyroidism, studying lipid transport disorders for research and genetics. Number 5. Why do need of this test? Standard lipid profiles measure total cholesterol, HDL, LDL, and triglycerides, but do not indicate lipoprotein particle distribution. Electrophoresis helps in understanding how much of the cholesterol is carried by each lipoprotein type. It is vital in detecting mixed dyslipidemias or rare inherited disorders not apparent on routine tests. Identifying the correct lipoprotein abnormality allows for personalized treatment and risk management of atherosclerosis and other complications. What happens during the test? Procedure. 1. Blood collection. A venous blood sample is collected, typically from the arm. The patient is usually fasting to prevent the presence of postprandial chylomicrons. 2. Plasma separation. The blood is centrifuged to separate plasma or serum. 3. Gel application. A small amount of plasma is placed onto an agarose or cellulose acetate gel. 4. Electrophoresis. An electric current is applied. Lipoproteins migrate at different rates. HDL migrates fastest, alpha band, LDL beta band, VLDL pre-beta band. Chylomicrons remain near the origin. Staining and analysis. The gel is stained, e.g. Sudan black, and analyzed visually or with a densitometer. The intensity and location of bands reflect lipoprotein concentrations. How long for my results? Turnaround time, 1 to 3 working days. Some specialized or confirmatory labs may take up to a week, depending on test volume and methodology used. 8. Prepare for this test preparation guidelines. Fasting is required for 9 to 12 hours before the test to avoid interference by chylomicrons from recent meals. Drink only water. Avoid tea, coffee, alcohol, and any fatty food. Inform the doctor about current medications, e.g. statins, steroids, diuretics, chronic conditions, e.g. diabetes, thyroid problems. Do not take lipid-lowering agents just before the test unless instructed. Now 9. Risks. This is a low-risk procedure. Risks are related only to blood collection, pain or slight discomfort at needle site, minor bruising or bleeding, rare risk of infection, dizziness or fainting, rare. 10. Normal values. Exact percentages may vary by lab, but typical lipoprotein distribution in a fasting individual is lipoprotein, expected band location, normal range, percent of total, 20 to 30%. Chylomicrons near origin remains there, absent in fasting sample. VLDL pre-beta region, 5 to 15%. LDL beta region, 50 to 70%. HDL alpha region, 20 to 30%. Interpretation of results. Fredrickson type, abnormal lipoproteins, electrophoresis pattern, associated risk, beta and pre-beta bands. Type 1, chylomicrons, dense banded origin pancreatitis. Type 2A, LDL, broad beta band, atherosclerosis. Type 2B, LDL, VLDL, beta and pre-beta bands, atherosclerosis. Type 3, IDL beta band, broad beta band, atherosclerosis. Type 4, VLDL, prominent pre-beta band, pancreatitis, ASCVD. Type V, VLDL, chylomicrons, pre-beta plus origin band, pancreatitis. Interpretation should consider clinical context, family history, and other labs. Factors of affecting results. Non-fasting samples may show false elevation of chylomicrons. Medications, corticosteroids, estrogens, beta blockers can elevate lipid levels. Statins and fibrates may lower LDL, VLDL, and affect interpretation. Alcohol increases triglycerides and VLDL. Pregnancy and hormonal contraceptives may alter lipoprotein levels. Thyroid function. Hypothyroidism elevates LDL. Liver or kidney disease can significantly alter lipoprotein profiles. Chart 13. Clinical significance. Lipoprotein electrophoresis is clinically significant for diagnosing familial hypercholesterolemia, combined hyperlipidemia, and other genetic disorders, identifying lipoprotein abnormalities in patients with early onset heart disease, detecting type 3 hyperlipoproteinemia, which may not be seen on a standard lipid profile, evaluating patients with recurrent pancreatitis, supporting risk assessment and treatment planning in atherosclerotic cardiovascular disease, ASCVD. No more. This test is semi-quantitative and used when routine lipid profiles are inconclusive. Advanced tests such as NMR lipoprotein subfractionation or ApoB-ApoA1 ratio are now available, but electrophoresis still has a role in rare or inherited disorders. Certain rare conditions such as abetalipoproteinemia, absence of beta lipoproteins, or Tange disease, absence of HDL, are best detected using this method. Conclusion. Lipoprotein electrophoresis remains a valuable diagnostic tool in the evaluation of lipid disorders, particularly when standard lipid panels are insufficient. It provides detailed insight into the distribution of lipoproteins, enabling early diagnosis of genetic conditions and better cardiovascular risk stratification. Though newer technologies exist, it is still widely used in specialized settings and research to unravel complex lipid metabolism issues. Would you like a PDF version of this? Thank you. Have a nice day.